very welcome to. So I'm delighted to introduce our panelists today. We have Julia Steets, Director of the Global Public Policy Institute, GPPI, and the lead researcher on the recently published Somalia IAHE. We've got Gareth Price-Jones, the Executive Secretary for SCHR, which is a group of 7 NGOs and 2 Red Cross organisations, and is also on the IAHE Steering Committee. And we've got George Conway online, who's the Deputy Special Representative of the Secretary General, Resident and Humanitarian Coordinator. Welcome all of you very much to what I think will be a very interesting discussion. First, we're going to start off with passing to Julia for a presentation to take us through some of the key findings from the report.
Wonderful. Thank you so much for the kind introduction and for setting this up. Thank you for being here. As Juliet said, we'll start with the findings of this Inter-Agency Humanitarian Evaluation, but then later explore what does that mean in the context of the current developments. Just very briefly on background, so this is an interagency exercise, or was an interagency exercise that focuses on the collective response of the humanitarian system as a whole. It's been overseen by an interagency steering group and management group and managed by OCHA, and we implemented it together with a Somali organization called RAKSA, and we did that throughout last year. And we were looking at the famine prevention response over the past 3 years. Very briefly on context, as you all know, Somalia is a context that has been in crisis for a very long time with a very vulnerable population. It was then hit by what was identified as the worst drought in 40 years, starting in 2021, and had a prediction of famine for different areas for late in 2022. We then saw with an activation of the system-wide scale-up protocols in the middle of 2022, we saw a massive injection of funding in the course of 2022. This was mainly from the US and mainly for food security or for WFP. So WFPs did not just increase in terms of absolute numbers, but also in terms of the share of the response of the funding that went to them from about a quarter to over half during that year. And I think anybody who's ever looked at Somalia knows how incredibly challenging an environment that is for working, for doing humanitarian work. I just listed the extreme movement restrictions for international aid workers here, but I think we all know there's lots of other very challenging context conditions. Now, what did we find? We tried to put the findings on a postcard, but as the ones in the room will notice, we didn't quite manage with one postcard. We needed 8. So let me go through them. First finding is that humanitarian assistance in this case actually helped avert famine and helped save tens, if not hundreds of thousands of lives. How do we know that? It's difficult to establish because we're talking about a counterfactual, but I think we have solid enough points that allow for that conclusion. Firstly, there were millions of people that got food assistance, and we have outcome monitoring that shows that their food consumption really improved. We have about 500,000 of children under 5 that were treated for malnutrition, and we know that over 69% of them recovered, and without treatment, many of them would have died. We also asked affected people in different areas what they thought would have happened without the assistance. And the biggest chunk of respondents were saying more displacement would have happened, but we also have a very large number of people who say more deaths would have happened in my family without this assistance. Now, the tragic reality is that even with that success, and even with the massive injection of additional funding and, of course, significant existing response, about 75,000 people did die due to the drought anyways. And we have excess mortality calculations from a scientific angle that come to that number. Another important finding is that This assistance also had side effects, and our postcard is that, clearly assistance creates incentives. We have a tendency to ignore them, and rather than doing them, we ought to work with them. What are these kinds of incentives? It was very clear in Somalia that where the aid is delivered influences, sometimes even determines, where people displace to, where they go to. And where they go to, in many cases, are very precarious sites that lack water, sanitation, health infrastructure, and that have very little opportunities. And so a lot of the deaths that we did see are due to, diarrhea, cholera, measles, so things that are to do with the living conditions in these sites. We also saw that the resilience of affected people did erode during that time, largely, of course, because of the simple severity and the length of the drought. But there are also some cases where the way the assistance was provided meant that it incentivized people to do things that were not good for their resilience. So, for example, there was a priority given for newly displaced people, new arrivals, and that incentivized peoples that were in sites where some resilience investments had taken place to leave from there and go to new sites that had very bad conditions and be there. And of course, in a context that has, as I think everybody would agree, an endemic corruption, it is clear that such a large influx of aid does increase the risk of aid diversion, and afterwards an investigation and then a big reform process on aid diversion happened. Security management and the related lack of international field presence is one of the factors that emerged as a recurrent obstacle to improving the way the response was done. The way the security management works at the moment is it has a strong reliance on hard security measures and very little field presence of international aid workers. These measures meant that the number of attacks did decrease compared to other previous sort of spikes in assistance, and particularly the number of attacks on UN staff and international aid workers decreased over the past few years that we covered. In fact, there were no attacks on international aid workers. The whole burden went to national aid workers. The current arrangements are very expensive. They raise questions in terms of humanitarian principles. And they make it hard to provide assistance in what we call hard to reach areas. And therefore, our postcard is what happened to stay and deliver. I think a lot of the types of recommendations in terms of reviewing the security management approach have all been very well articulated before, but we don't see them implemented. On coordination, if this works. No, it doesn't work. Thank you. I think, first of all, we have to recognize the contribution that coordination and leadership made. Somalia is a place from where we see a lot of innovation and good practice on risk management, on third-party monitoring, on feedback mechanisms, on the way aid has been prioritized, on reform processes to handle aid diversion. All this is linked and due and thanks to coordination and good leadership. However, cut the coordination clutter is our postcard. The structures that we saw operating were way too heavy. They focused too much on processes, and they still were very weak on data. And therefore, I think, if I'm not mistaken, there are some global rumblings at the moment to make the coordination system leaner, and that's something that gets a lot of support through this evaluation and many others, I believe. Accountability. Accountability to affected people is one of these issues, I think, worldwide that we've had on the table for years. We have seen important investment in Somalia. There was investment in lots of individual hotlines, for example, accountability systems, but not much that was successful in terms of bringing these together as a system-wide accountability system. And we see that people are still not well enough informed, not enough involved in making decisions that concern them. And we have so many different hotlines where people tell us very often when we try to call them, they're actually not working. To us, this was symptomatic of a broader problem, which is that we do have the tools to identify problems like the lack of accountability to affected people. We have operational peer reviews, we have inter-agency humanitarian evaluations, we have lessons learned exercises, but we don't have the systems in place to make sure that there's follow-up and action taken to rectify these issues at country level and at global level. And I think it was important to see that for many of the issues identified at the country level, we do also need global action to be able to address the obstacles. As I said a minute ago, one of the good practices from this response was that we did have a clear prioritization process going on that identified sectoral priorities and, in what were tough choices, chose to focus on a narrowly defined set of life-saving sectors: food security, health, nutrition, and WASH. However, we saw that when implementing that, not all sectors managed to implement and scale up at the same rate, and WASH in particular was lagging behind. And the types of mortality analysis we had show that that really caused a problem for the people. The local pooled fund was one that showed a strategic response to that. It invested strategically and clearly into WASH. A priority also, and one that was also expressed through the centrality of protection strategy, was to increase the effort to reach marginalized clans. This is something where we saw real progress over the past few years, and one where we saw international organizations take relevant steps, but where in the delivery, local organizations were really key, and also in terms of what progress we had in terms of reaching hard-to-reach areas, local organizations came out as a really important factor. And again, the country-based pooled fund, the Somalia Humanitarian Fund, turned out as a really strategic investment vehicle because it supported localization. It invested 60 to 70% of its funding to directly support local actors. This is again, here we go. I mentioned that aid diversion and the increased risk of aid diversion due to the influx of a lot of additional resources were an issue. We did have a big process and a related reform effort from the humanitarian country team on aid diversion that holds a lot of interesting lessons. One is that we need more attention for risk mitigation on aid diversion when we do scale-ups. We heard many people say we had a no regrets approach, which in their case meant we didn't worry too much about risks, which we think is not at all the right way of understanding no regrets. No regrets means you go in early, and if then later on the hazard doesn't turn out as fierce as you feared it would, then you have no regrets. So we try to shift the awareness here, saying that we need to have more attention for risk mitigation measures from the get-go when we do scale-ups. In terms of addressing the aid diversion issues, I think the reform effort that was implemented was really, really helpful in terms of rebuilding trust, creating a setting of transparency and cooperation between different types of agencies on the ground, and made a lot of progress in terms of putting in place processes. But also, it's clear that these are very hard issues to fix, and that a joint approach does continue to face challenges, especially on areas where there's also a need for global support and global changes. That's a sort of lightning tour through the findings. I wanted to sort of have a quick reminder on where, when we shift then later on to where does this leave us in this context where aid budgets are being cut as they have not been cut before. And there is a public perception that the amount of money we spend on humanitarian assistance and development aid is huge. Very often this is completely outsized. So people think like 15–20% of public budgets go to humanitarian and development assistance, which couldn't be further from the truth. And so we thought it was worthwhile doing a reminder that this extra billion that was invested here is not a little, but if you put it into perspective compared to what the US government at least used to spend until last year, in a year, it corresponds to about 80 minutes of government spending in the US. So just to give us a little bit of perspective. I'll leave it at that. The report is available for download with this QR code. You can also, I think, easily find it online, and I believe it's been posted in the chat if you want to read the whole thing. Thank you.
Great, thank you very much. And yes, I do encourage everybody to take a look at the report. There's a very excellent executive summary as well, if you don't have time to read the whole report. But yeah, I mean, in ALNAP, we always say, like, the sector is rich in learning. We have this wealth of learning, and we also have no obligation and an accountability to learn from the experiences that we have, particularly when we're faced with the difficult context that we're facing now. And what you can find in the evaluation report is lots and lots of examples of where there's important learning with mechanisms that do work and changes that can be made to be taken on board. So first of all, I'd like to pass to George to hear a little bit more about, in his role as the HC, how this process was for them and how they've made use of the results. Over to you, George.
Well, thank you. Can you hear me okay first?
Yep, all good.
All right. No, thank you to the organizers for putting together today's session. It's certainly timely and I hope helpful for all. And of course, great thanks to Julia and the team for the evaluation itself, for the robustness of the process through which it was conducted, and for the quality and usefulness of the final product, which we greatly appreciate. You know, the extent of the consultations, both with humanitarian actors, with other stakeholders, and of course, and in particular with community members, including in some very hard to reach areas across the country, I think did contribute to an important validation of both the positives that are reflected in the evaluation itself and the fact that it saved lives at scale at a time that was critical, as well as some very useful pointers and recommendations in terms of areas that we need attention, has been very, very helpful. So again, and this was said already, but the scale up and the associated financing of the scale up did prevent at scale excess mortality. Yes, tragically, 75,000 people still died, but the counterfactual, I think, is an important one, and that number would have been much, much higher if this response had not been in place. And I appreciate the positive findings in terms of other areas of the response that were deemed as very valuable, including the work that had been done on the centrality protection, the improved inclusion of marginalized clans, while not perfect, was an improvement nonetheless. The role of the country-level pooled fund, what we call the Somalia Humanitarian Fund, the SHF, in particular on the localization agenda and our ability to deliver localized area-based responses, and the positive spillover effects for the Somali economy that were highlighted in the report as well. I mean, these are all very well received, and my due appreciation to all humanitarian actors and to donors that were involved in the scale up. and went to significant lengths to ensure that even further levels of excess mortality were prevented. The areas of weakness identified in the report are all well taken. Many of them were known to us, and some of them were things that were very helpful to put them very agenda, including undermined resilience building efforts. The issue of people moving from sites of resilience investment to new IDP camps is a well-noted challenge, and it's interesting and good to have that validated with because it does impact on our current strategy as we look forward. We can come back on that a little bit later. But also the issues around accountability to affected populations, the challenges around harmonizing community feedback in much more accountable ways, and of course the aid diversion issues, which rose to prominence and were elevated within the UN system in the midst of the scale up itself, and that have received quite dedicated attention in the subsequent 2 years. So these are all areas that either we knew that we needed to work on, and this validates that these are important areas of focus, and or they're things that have been brought much more to the center of our attention moving forward. So the evaluation itself, both in its conduct and in the report, have been a catalyst for some quite challenging discussions within the humanitarian country team around how to do business differently in this context. How is it that we can address some significant inefficiencies in our response, address chronic deep-seated challenges that we've known about for a very long time, including on, for example, aid diversion. That's been a chronic aspect of or chronic challenge of the aid delivery landscape in Somalia for a very long time, and to strategize and agree on ways and mechanisms to address these. And we had already, in the course of the evaluation, started a number of humanitarian country team related reform efforts. This validated our path of travel on some of those, and has created additional work streams. Now the report has been finalized in areas that we weren't dedicatedly working on yet. We did, in fact, just this morning, receive the formal transmission from the ERC of the report requesting our management response by May. So we've already started working on that. We agree with the recommendations and the findings. I know there may have been some on an individual agency by agency or partner by partner basis, some sense of, that's some of the wording might not be fully agreeable, but I think at the end of the day, as a country team, we were very happy to endorse the report and to agree that we needed to work collaboratively to address its findings. So that is in process, in addition to the country level stuff, which is quite substantive and reflects some deep-seated challenges in the way that the system has been structured. I think it's been very helpful as well that the report identifies these system-wide issues that have been chronic and problematic for some time, and elevates them for the attention of the IAHE structures at a corporate level. And in the transmission from the ERC this morning, the ERC did assure us that the OPAG and the EDG were reviewing these system-wide issues that were raised, and taking a due action around them. And this includes on financing mechanisms, including for anticipatory work, exactly this issue of streamlining coordination systems and trying to match our legacy cluster system together with newer ways of doing area-based localized coordination. Again, this issue of harmonizing community feedback mechanisms, which, there's a very useful 2-page summary of the long history of trying to work on this issue with limited results and impact because of agency-owned interests in maintaining standalone systems and such. And this, again, because of the nature of the evaluation, it gives us a solid footing on which to start to address these issues at structural levels and at higher order with ownership of the agencies themselves because of the nature of the IAHE. But also this issue around harmonizing more common processes for, and in fact, we've already rolled out earlier this year a new HCT policy on these issues that we recognize is going to be progressive and incremental in terms of adherence, but current context that I know we'll come back and talk about specifically of the need for a much more streamlined, efficient response, I think moves us forward, which is good. And maybe, just as one additional comment, it is interesting how this evaluation did foreshadow some of what the ERC has now put on the table by way of the humanitarian reset, and had already identified some of the issues that we've now been further tasked from the ERC, all humanitarian coordinators and humanitarian country teams, to do this hard work, and to he is working with IASC principals to help create conditions for change on some of these chronic issues that haven't been able to be progressed on in the past, which we appreciate. Now, there's a lot more that I could say right now around implementation to date on specific findings, whether it's on aid diversion, whether it's on the issues around meaningful community engagement, our revisions to our coordination architecture. And again, this is an area that we have agreed on a new model that tries to simplify, that maintains the intents and purposes of the cluster system, whilst trying at ground level to really work with local partners on an integrated area-based response, but without building excessive bureaucracy around that, and other areas as well. But perhaps I'll leave that for the Q&A in case people have specific interest in delving into individual issues of such. I park my comments for now, just again to repeat the appreciation for an exercise that I do think has added quite significant value to our understanding of what happened throughout the scale-up period, that did take into account at our request, which I appreciate likewise, is the follow-up, especially on the aid diversion side, to identify whether we were on a good track in that respect. And I think has provided us with a very valuable evidence base for the further reforms that are necessary moving forward. So thank you very much, and I look forward to further discussion.
Great, thank you very much, George. That's really helpful. And yeah, do keep a note of your questions and comments as we go through, because we will be protecting time for discussion at the end of this session also. Gareth, maybe I can pass to you next. George made reference to system-wide issues and being highlighted in the evaluation, and it'd be great to hear how you see the IAHE report being used and how it's kind of being used to engage with the global bodies.
Yeah, absolutely. And just to explain a little bit, so my primary role is as SCHR's representative at the ISC principals, but because we're an extremely lean secretariat, I also sit on the Emergency Directors Group and the OPAG, and as mentioned previously, on the IAHE steering group. So I'm both fortunate in being able to use these kind of reports quite effectively, but also see how they get used by others. A couple of points to pick up on. One is, George, you mentioned the point on agency interests. I think one of the things that I hugely value about the IAHEs, including this one, is that they are commissioned by the IASC members. So that's the big UN agencies, the Red Cross and the NGOs. But they're independent. So occasionally we'll get efforts to kind of nobble or water down, but they're really independent. They really challenge us as a humanitarian system, an ecosystem. But I think also they are owned. So they're owned by us. We commission them collectively. So they're owned, and that gives them a certain amount of traction within the collective global body, which as you say, you've got an ecosystem of lots of different actors that work in different ways that have their own interests. And so having these reports that are really robust, I mean, Julia reminded us of how many people you spoke to, but they're really robust, and they're also connected to affected people's views as well. So I think that's really important. And it's one of the findings is the accountability challenges, but I think these reports are really important in accountability terms in themselves. So as the emergency directors and the OPAG were briefed on this back in December, I think it was, when you briefed us, those findings have already been integrated into a lot of our thinking over the last few months. Of course, that thinking has really accelerated since we had the reset, the massive drop in funding. I think also what's useful is looking at, for example, how we've used both this report and the previous Yemen IAHE to, for example, steer the change that we're trying to bring about in how we manage security across the ISC. Particularly, it's a challenge for the UN. And both reports are extremely useful for our colleagues in UNDSS who are trying to change how they work. And having these really robust, independent, quite challenging findings that we can apply, that we can talk about is really useful and valuable. I think also one of the things to note is these reports are public. Everyone can read them, and I think that's really important. Again, they're commissioned by us, they're owned by us as a humanitarian ecosystem, but they are publicly available, which means journalists, others, and I'd really encourage people to think about how to do this more creatively, can pull from them. They can, for previous ones, not on this one, but I think we might have it soon. But there's been articles in the New Humanitarian, there's been articles in local press, and I think that's really important to kind of connect our thinking as a humanitarian ecosystem at that collective level to kind of plug that into affected people's perspectives and also views from right across the system. We know that when you do a particular evaluation on just your organization's programs, then you'll be looking from an organizational perspective. One of the things that's really valuable about the IHEs is that collective element. A couple of other points to note. One is I think we need to do more to plug the reports into donor and local spaces. Donors do say they use them, but I think we could be using them more to influence donor decisions. Particularly, you talked, Julia, about the challenges of proving counterfactuals. I think one of the things that's really stark in this report is how important that big injection of funding was. That's not going to happen, sadly, over the next few years. We're very clear that between the US and the other big donors who've been cutting, we're not going to see these kind of injections, for example, in Sudan. And so what's really important for us is to capture the impact of that as we move forward and say, look, here you go, we've got very robust evidence in Somalia. Here you go, these are those tens, if not hundreds of thousands of lives that were saved. That's not going to happen in Sudan. I hope it won't be a disaster, but I suspect it might. It's really important so that we can then go out to the general public, go out to politicians and say, look, we could stop this stuff. We've demonstrated here in Somalia, yes, it was imperfect, but it made a huge impact to affected people. And here in Somalia, here in Sudan in 2025, 2026, did that happen? And so I think, again, this is really important for building that general public support, that political support for aid that we're clearly really struggling with at the moment. Also great to see that pooled, and this is where this is already influencing. So one of the things I really picked up from the report was the gap in WASH and the way that pooled funding was used effectively to plug at least some of that gap. That's something it's already influenced decisions. So at the IHE principles, we've already agreed that 100% of pooled funding should be going to local actors. It was slightly watered down in Tom Fletcher's letter, but that's the gist there. There's some caveats on there. But so that should give us a bit more flexibility, and that's a tool for managers on the ground, for people like George to use when they're talking to their HCT and say, hey, look, we've got this commitment from on high. This is how we apply it in our context in Somalia. And so again, that's where you see that evidence, hard evidence, coming through and influencing those decisions that are being taken at the high levels. So I think I'll stop there, but come back with the Q&A. So
yeah, that's great. Thank you very much. When we were talking last week as well, it's like IHE reports have a long shelf life. They capture a moment, not only for the decisions and the considerations of now, but also over time. And at this session last year, we were talking about the Afghanistan and Ethiopia ones. And actually, as you see the trends in learning consolidate across IHEs over time, it's such a robust evidence base for the sector. So it's very strange now to read the evaluation report, given all the shifts in context since you drafted it. And in one way, like Gareth said, the fact that we're aware that those big injections of funds are not going to be there in the future, and this sort of grief of the loss of that ability to be able to do things that we know work. But at the same time, there's lots of really important bits within the report that give you a bit of buzz and hope for the future also. So Julia, maybe we can hear a little bit more from you on your reflections on the implications of the findings for these kind of transformative discussions that are now being had.
Yes, thank you. And I think that's thoughts that are keeping all of us busy. On the one hand, I think still trying to figure out what actually is happening. And I'll start with that. And then, okay, and what should we do with it? On what is happening, I mean, we all agree that funding is going down drastically and will likely stay down. What are we talking about? Probably somewhere 40 to 60% or so of something of that scale. I think in other sectors you would, that's a little bit like the German car industry, which is they do. Now, what will that mean? I mean, in my mind, I see sort of several scenarios, and one scenario is that this means sort of a protracted series of restructuring exercises where I think for now, at least at headquarters level, from what I've seen in many organizations, we've gotten rid of largely the nice to have things, 10% here, 20% here. It hurts, but it hasn't affected the core functioning yet. In the field, I think it's often a lot more drastic already. But so I have the feeling that if we're going in this restructuring mode, we're not done yet. We may go through several such steps. And one thing that, and that's where the analogy with the German car industry comes in. One thing that I think is also possible is that we may see more drastic collapse, really, organizations going quite simply bankrupt, because what we're doing, or what in some areas what we're seeing is that the first thing that's being cut is programs. This is like stopping your assembly line, because it's nice to be able to save costs. That drives up the proportionate cost of overheads, and normally the kind of money we have in the humanitarian sector, you can't just use it whichever way you want. You use it for programs, and then you get a certain percentage for overhead. So I'm not sure whether that will happen, but I think we should definitely consider that as a possible scenario, is sort of who will actually collapse and go bankrupt. Now, of course, this is either way, it's tragic, because as we just discussed, this is a system that, for all its flaws, has been delivering. We haven't seen mass fatality events that we saw in 30 years ago, 20 years ago. And we have managed to avert famines, and I think not just in Somalia, and have managed to avert mass fatality events elsewhere. But these two different scenarios that are outlined have different implications as to how free we are to rebuild the humanitarian system after the storm has passed, after it has downsized. And therefore, I think it's worthwhile now, even as we are all suffering from what is happening, to ask ourselves what kind of system do we want to have afterwards. And I'm very happy, Gareth, about what you said about already there being decisions taken to at least use country-based pooled fund to support local organizations, because I think we all know local organizations have a lot of capacity. They are cheaper, quite simply. And we have a system in place to actually support them effectively, country-based pooled funds. Now, I think just using what we have in these country-based pooled funds, which still account for a very small percentage of overall humanitarian funding, and give that to local organizations, that's not going to cut it. But I think we have a vehicle there that, if we're thinking about a more fundamental restructuring and reshaping of the system, that we could use. And why not, if we need to try and save lives with a lot fewer resources, why would we not give a much, 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 much larger share of those resources to country-based pooled funds, with the direction to hand that directly over to local organizations? Now, this is a tough decision, because obviously it's not good news for some of the international NGOs, some of the UN organizations, and their operational delivery role. But I think that it's something that donors do have to decide now. And unfortunately, it's a little bit like having the choice between, do we want to save institutions, or do we want to save lives? So I think that's the tough moment that we are at.
Yeah, the the pooled funds really stand out within the report as a huge positive. And there's a couple of like slightly shocking stats. I know it's always the numbers that stick in your head, but the suggestion of cutting the coordination meetings and fora by half is quite stark. And the other one, I'm just looking at it here, the mapping identified 72 hotlines, feedback hotlines, across 58 organizations. These systems, however, are not very effective. Among the people consulted for this evaluation, 65% of those who provided feedback or filed a complaint said they did not receive a response. So even in our kind of what we could, I suppose, call efficiency savings, there's a lot of investment in things that have an essential principle behind them that isn't actually bearing out through the experiences in these very kind of acute situations. So here in Geneva this week, for those online, there's obviously a lot of talk about the implications of the funding cuts and how people are going to manage it, both on kind of institutional levels and also sectoral levels. But I wonder, George, if we can come back to you for a bit of a reality check also on how you see the situation evolving in Somalia and what discussions there are about system restructuring and transformation at a country level.
Thank you. And thank you, Julia, for the broader considerations on this question. As with the global figures, the US is, and this was reflected in the first presentation, has historically in recent years contributed 54% to the humanitarian response in Somalia. There have been some exemptions and waivers issued in some specific clusters, but the simple fact of the matter is this cuts deeply into the response. And we've been through, as other humanitarian country teams have, a radical prioritization exercise, which in our case is causing us to focus very narrowly on people in IPC4, in food security emergency, and children in severe acute malnutrition. And to do a geographic, likewise, reprioritization based on areas with the most severe impact. This is now 2 years from the scale up itself, and we find ourselves in a situation right now where the deer rains, the short rains at the end of last year, underperformed, and the projections are for the upcoming GU rains, the long rains, to likewise underperform. And the projections are that this will add an additional 1 million people to the people facing acute food insecurity over the course of the next 3 months. If the GU rains do fail, we find ourselves in a situation that looks eerily similar to what we saw in 2020 was declared. And that's very, very worrying. Because we know that we will not get that anywhere near that scale of resources. In fact, we were looking at, again, a fairly radical prioritization based on our humanitarian needs and response plan issued at the beginning of the year. We feel remains valid in terms of a definition of the needs, but our response capability against that in terms of targeted figures is going to be severely curtailed. And we're doing that work right now and discussing with local stakeholders in terms of what that means. On some of the specific issues raised on the country level pooled funds and localization, Somalia has now the highest rate of localization compared to any other country-based pooled fund in the world. And we have for the last 3 years continued to increase our target for working with national and local partners as part of the fund. I think our target for this year was 85%. So it's been on an upward trajectory, and it will continue to do so. I'm pleased to hear that 100% with some caveats is the expected to be the new norm, because I do see this as a strong comparative advantage of these fundings, and I think we should be collectively advocating for more money to coming in through pooled funds, and in particular in this very altered donor environment. I think based on evidence that the greatest value for money and bang per buck comes through these mechanisms. The evaluation helps us to evidentiate that statement, although we have other data in that respect. this issue of the hotlines, you know, and the proliferation of them. This is acknowledged as the evaluation itself identifies. You know, this has been an issue for over a decade, that there's just been no institutional willingness from the maintainers of those respective hotlines to compromise on. And now I think we're in a context where we have to. And, you know, as we've looked at the issues around what are the services, what are the activities that are being funded individually by agencies that could benefit from significant harmonization, simplification, and unification, that's certainly one of them that is on the list. But there's others as well, with multiple mechanisms for displacement tracking, different methodologies, and multiple registration regimes from different entities, multiple types of needs assessments being undertaken of the same communities by different actors in different clusters that could be better integrated. Third-party monitoring is one that's come up in terms of, again, a proliferation of different types of mechanisms. All of these are things that we need to be looking at, harmonizing, unifying, and ultimately being much more efficient in the use of scarce resources. And the humanitarian country team is doing that work now. It is tough, it is difficult, but it's absolutely necessary. And again, if this can be backed up and supported at corporate levels, and, you know, we all humanitarian coordinators have been requested to submit to the ERC our, you know, what are our plans for what we're doing in this context. These are some of the issues that we've identified in that plan. We did go through, as a result of the post-delivery aid diversion issues, a significant deduplication exercise between agencies that, you know, again, there was some significant inefficiencies in terms of coverage. And not just in terms of duplication, but also inclusion and exclusion errors. With, you know, and in some areas, there was quite a high level of inclusion errors. People that shouldn't have been prioritized for assistance were getting assistance. And then the people that should have been getting it weren't. And so we've gone through quite a robust process to change the way we do targeting, including from a status-based process to vulnerability-based targeting, combined with this new guideline that we've issued around registration and data sharing, that hopefully will continue to find system-wide efficiencies that will mean that more scarce resources really get to the people that need it the most, in the absence of other social protection and support systems nationally. I'll park my comments there.
Great, thank you very much. I'll pass to Gareth for some further global level reflections on the same would be great.
Yeah, thanks. So I think one of the big things we're looking at globally is around the kind of sectoral approaches, particularly with this kind of enforced sharp prioritization. One key takeaway for me from this IAHE in particular is the imbalance between sectors with that gap in WASH. And I think that is, there's no good doing relatively expensive food distributions if diarrhea is undoing all the benefits of that. I think the challenge with that is at the global level is, of course, we have mandated agencies who can't switch from one to the other. It's a bit more flexible for the INGOs, but we do need to make sure that we're doing the most impactful interventions and make sure that we're talking to donors to make sure that they're incorporating that stuff into their decisions. I think, and again, that inputs into bigger discussions about how we rebalance the systems, in particular ensuring we're using the right mix of funding channels and we're using the right methodologies. So, for example, are we doing agriculture over food distributions? Are we doing water tracking versus kind of other WASH kind of solutions? Just making sure that we're using the most efficient methodologies as we go through this extremely tough time. I think just on that methodologies and funding channels points, I mean, CBPFs are relatively flexible, but they're still not the best solution, right? And we do have a range of solutions there. We have the START Fund, NEAR has a fund. Some of the big INGOs have flexible humanitarian funds that they can deploy much faster than country-based pooled funds. So CBPFs are part of the solution, but they're not the only solution. We need to be kind of fully flexible when we're looking at that. And it's great to hear some of the progress George was updating us on there. One of the other things that this kind of evidence really plugs into is those global discussions of shared services. What's essential, what's enabling, how we channel those shared services. I mean, I think particularly we learned a lot from the COVID, where we funded, and all of us, so including the NGOs, including the Red Cross, advocated very strongly for some UN-provided shared services that turned out to be actually probably not the best use of our money. So making sure that we're being efficient, saying actually this is an area where, for example, WFP is the best provider. And then actually these are examples where maybe private contractors or others can do it better and cheaper. I think it's also worth noting, it's great because this always comes up, and we've talked a lot about it at the global level, but this kind of cutting coordination kind of bureaucracy. And one of the things, we did a quick calculation in SCHR around how much we would save by kind of cutting out those global coordination things in terms of meeting costs and staff time. And we worked out that probably at the upper range you'd save about $5 or $10 million on a $30 billion system. So I think we do also need to be realistic about the kind of cost savings that can come from that. Yes, we need to streamline everywhere, but strategically with the big picture, how much difference does that really make? And then the last point I have is I think one of the things that this IAHE in particular really highlighted is the importance of relearning those lessons from the 1990s on incentives, on political economies around aid. The 1990s, for those who like me weren't around, we learnt a huge amount from particularly the Rwanda DR Congo response around how providing poor quality aid could provide enough incentive to drive what affected people do, and often in that case it resulted in a lot of them being trapped under the control of armed groups. We need to really plug in that as we scale down response, we need to make sure that we're maintaining quality, that we're continuing to apply those lessons so that we're not creating those perverse incentives, that we're not worsening the situation. And I think that's a real risk. So, sphere standards came out of that response as part of making sure we weren't offering those. And I do hear quite often, particularly from country level, worrying conversations, well, surely something's better than nothing. And we know that actually something isn't always better than nothing, and we do risk doing harm. So I think that's actually something that we're really trying to work hard to plug into global conversations as we go through this contraction of the ecosystem. And I think the evidence, like we have on this report, is really essential to make sure that we're applying those lessons and continuing to apply them, even where desperation might tempt us in other directions.
Great, thank you very much. Now's an opportunity for questions or comments from those in the audience. For the ones online, do they need to drop them in the chat or can they speak? Okay, so those online, we may even be able to hear your voices. If you have a question or comment, please do raise your hand. Yes, sure.
Hello, everyone. Thanks so much, Julia, for nice presentation, and the other colleagues as well. I don't know if you can hear me. I have two questions. One is good that you mentioned that large-scale responses increase the risk of aid diversion. A topic that is normally not talked about, gets a little bit of the publicity that it might deserve. And at the end of every crisis in Somalia, we talk about aid diversion. So one question that I wanted, actually two questions that I wanted to ask is, one, were you able to estimate, for example, in the recent drought, how big the aid diversion was, or was there any estimate how much was lost? And with the funding cuts and the reduced funding, which means reduction of some of the mitigation measures, because the system will also go down if we are going to see more diversion in the future with upcoming crisis. And then I'll add one more and then pass the mic. The other one is about localization. You mentioned that about 60 to 70% of the HSF funding went to localization, whereas the local agencies still face barriers in getting funding directly from donors, other donors. And I'm wondering if there were any lessons learned that can convince other donors to follow suit. Thank you.
Great, thank you. Any other questions? Yeah, go ahead. George, can you hear all right on the mic? Can those of you online hear okay? Good.
So thank you for the presentation, Julia. It's always great to see each other in different places. So I wanted to ask you, when do we learn? You know, going back to the permafrost discussion, Juliet, because if we look at the different interagency humanitarian evaluations that have been carried out in Somalia, a lot of these issues are repeated. They're not new. They keep on coming. And now that we're in this funding crunch, is there any bandwidth to learn? Or we're just sugarcoating things? Because I do have the impression that people that are to take decisions on numbers. And I liked a lot how you finish there with, do we save institutions or do we save lives? Because I think that's the quintessential question that we should ask ourselves.
Yeah, great. Any other final questions? Or we'll go to those ones. Let's go to those ones. Panelists, who would like to start? Julia, do you want to start?
Of course, thank you. Were we able to estimate how much was diverted? No, sorry. Super difficult to do, and I think, but there was a UN process with that came out with a report. To my knowledge, it doesn't have a real estimate either, but I think in terms of understanding how diversion works, that is something that is really possible to do. Your second part about will the cut also cut mitigation measures and therefore, you know, lead to an increase in diversion goes exactly to what Ricardo asked on, you know, when do we learn and how do we learn? I think there's a real risk that this scale down could be unstrategic and chaotic and lead to exactly important things like risk mitigation falling away, or what Gareth said, things that you know, we've learned in the few years. And I want to also say there are things that we have learned, and we've made a point in this evaluation to also highlight where progress happened, because progress doesn't happen everywhere, of course not, but it does happen in some areas. For example, the inclusion of minority clans in Somalia is something where we clearly see, you know, from this being recognized as an issue, talked about, included into strategies, and then actually changed. But there is a risk now to have a chaotic, unstrategic kind of drawdown that would not help with that. Let me stay on that briefly before coming back to your SHF point. Do we have the bandwidth to learn right now? I think it's really hard, and I think a lot of organizations are so kind of caught up in survival strategies. It takes a lot of effort to restructure, to try and find pathways to, you know, deal with this funding crisis that understandably a lot of the leadership and management, I think, is preoccupied, and, you know, rightly so. They have a responsibility for their employees and of course also for the program. So, you know, it's understandable that they would be preoccupied. My fear is that we will go through this process and just come out with something much the same, but much smaller than we have now. I think that would be a disaster, particularly because during the transition time, it takes a lot of time to reduce overhead costs, right? We're very slow in this. We have big buildings, we have lots of people on permanent contracts. You can't, you know, if you're not Elon Musk, then you can't throw people out tomorrow, you know, this evening. During the transition, if in the scenario of gradual slow restructuring after restructuring, we would use most of the resources really in that overhead to draw it down, and we may land somewhere that is exactly the same with exactly the same institutional interests, just at a half size or third size. Now, I don't think that would be a good outcome. And that's why I think it's important to discuss right now more radical alternative scenarios, even though I feel really bad doing that. You know, of course, these are organizations that did great stuff and have good people. And it's very hard to say, well, you know, if we got to choose who ought to die here, the institution or the people on the ground, let's choose the institutions. That's not a nice thing to say or to think. I still think it's the right thing. And I do think that there are people who actually hold the keys to making that decision right now, and it is the donors, because they can decide. You know, they are approached every day now by people saying, oh God, we have a terrible, terrible gap here, can you please step in? And clearly they can't step in everywhere, so they need to decide where they step in. And it's a tough decision, but I think they could do that, and then I think we have a huge chance to learn when we rebuild and we do this classic build back better after the storm. Last short one on localization. You said, you know, local organizations have not been so successful in getting direct funding from the donors. To my mind, that's not realistic. You know, if I look at my country, Germany, they don't have the capacity to be in Somalia, to do the due diligence, to allocate this money in a useful way. If all the donors tried to do that and build that capacity, we'd have massive kind of bureaucracy sitting on the ground. And that's why I think a pooled fund solution is obvious if you really want to do localization, because you need to be able to do the due diligence. You need to be able to support with capacity strengthening. You need to have a real tough monitoring and evaluation so that the moment something doesn't deliver, you switch out the organization. It's got to be a fairly tough system. And that, to my mind, only makes sense in a pooled way. So I wouldn't aim for increasing direct contributions from all these big bilateral primary donors, but look at the pooled solution.
Thank you very much. I can see George nodding. George, maybe pass to you for some reflections.
Thank you. No, and thank you for the thoughtful questions. On the first speaker's question, which Julia certainly touched on in terms of whether we'll see more aid diversion as a result of this current situation, you made the statement that aid diversion isn't something that we've talked about. I have to say, in the last 2 years in Somalia, this discourse has changed quite a bit, and it is a conversation that we're having with government. Certainly, you know, within the humanitarian and development community, with the donors, with government at different levels, including from the Office of the Prime Minister down to district commissioners. And you know, the ability to have this conversation has changed quite dramatically, which I think is an asset. And states have started putting in place legislative frameworks on this, including Southwest State, which about a month ago, the president signed off on an aid diversion law that criminalizes a diversion of aid. I mean, this is something that hasn't been done before, and other states are following suit on this. And the federal government is now looking at what needs to be done at the policy, regulatory, and then legislative level on the same. So, you know, this is not to say that the phenomenon has gone away. Of course, it has not. And we do have now, we actually have very good mapping of allegations of aid diversion that are issued on a quarterly basis with reporting from a good number of agencies. That allows us to see where the hotspots are, what the trends are. And this is a direct basis for advocacy with state and local governments around the incidence of different types of diversion in their respective jurisdictions. And then that is good. But also at the same time, you know, the shift in some of our modalities, including as a result of the local policy that I referenced around targeting, registration, and data sharing, have allowed us to circumvent political interference in beneficiary selection. And it's created a lot of tough moments with local authorities, with district councils, and with even local security forces in some areas, as we've identified the people that shouldn't be receiving aid and the people that should be receiving aid, and make those changes to focus on the most vulnerable. And that's hard work. That's being done by people on the ground, and with direct advocacy to ensure that aid gets to those that need it the most. So I do believe we're making some progress here. there's been waves of how aid diversion has been elevated in prominence in Somalia over the past 15 years. And we've seen the focus on it come and go and come and go. This does not go away from now. This is for our humanitarian country team, this is an enduring feature of our dialogue and of our work that does not get stood down, because we know these risks are chronic and they're ever present. And we are taking concrete measures to address. On this issue of when do we learn, and is the system really going to change? I agree in large part with Julia's comments, but at the same time, I do think we have an opportunity here, and that opportunity is being seized upon in responsible ways by UN leadership. I do believe that the ERC is taking this challenge very seriously in consultation with IAHE principals. You may have seen 2 weeks ago, the Secretary General announced a UN 80 initiative that puts on the table issues around efficiencies, really scaling up, built on the UN development system reform efforts already that have been underway since 2019, but scaling up the efficiencies discussion, having a review of mandates, which is something that the system has been willing to go down the line of in the course of many, many years, and looking at the potential for program realignments, which again is a discussion that's been very hard to have over recent decades, and there may be an opportunity to do that now. So, from looking from a humanitarian coordinator and resident coordinator's perspective, I do see a good opportunity here. That opportunity is accompanied by massive risks. And we can't downplay what those risks are going to be in terms of delivery services, and that has to be our primary focus in terms of getting aid to the people that need it the most. But if this does create an institutional basis for pushing through some discussions and change over the course of the next period, I think we need to seize that opportunity. Thank you.
Great, thank you. Gareth.
Thanks. So on the aid diversion, and great to hear that update from you, George, on what's happening at the country level, but also at the global level. So we've had a small subgroup of the IAHE EDGs has been meeting with donors over the last 6 months rather. We do have a kind of quite sharp document that hasn't, in fact, it's on my to-do list to try and get it pushed out. But so I think those discussions have been happening, and they're quite pragmatic as well, recognising that due to the context we work in, of course, it's always going to be a challenge, but how do we mitigate it? How do we prevent it? And how do we manage? And also, I think particularly following some of the higher profile in Somalia, what was interesting was those dynamics about how much of this is political economies and how much of this is actual, I think those dynamics and discussions are really useful. One of the things that I'm really worried about is the risk of weaponization of aid diversion. We've seen particularly the members of the US administration who've been pushing out huge amounts of mis and disinformation. And of course, they're extremely effective when they're based on a core of truth. And so that's one of our real worries, and partly why it's on my to-do list to try and push us at the ISC to collectively agree more on that, because it is a big risk to all of us and to our effort to mobilize resources for affected people. On the localization, thanks to you. I think that's really good. And we don't have enough discussion around the challenges of that and how desirable and possible it is. So I think there's a huge issue about two things really. One is economies of scale, and one is access to donors and those challenges that you would need huge donor bureaucracies to channel funding directly. And that's a conversation that we've had a lot of at the Grand Bargain, that hasn't necessarily, I think, been quite as grounded in reality as it could be. There's a big piece there where we've invested along with IFRCs around the intermediaries work about how we make sure that those channels to get funding at scale to local actors are made more efficient. And as I said earlier, the CBPFs are one way of doing that, but there are others. The NEAR Fund, I think, is quite exciting, the START Fund, that could be done at much greater scale. But I think there's also, and one of the things we were trying to push with the intermediaries work through the Grand Bargain was this idea of better capturing what the value add of those intermediaries are. Why are they needed? What do they bring? And capturing that. And we're not very good at talking. A very clear example is brands. Brands in the commercial sector are ranked at billions of dollars because they substitute for they're an indicator of trust. They're an indicator. They smooth the pathway because it's a known quantity. And we don't talk about that in our sector. And I think one of the things is capturing that much better. I think one of the other things that's really interesting on localization, so one of my SCHR members, their new international humanitarian director, his last job was with the Somali government. And I think that interchange between governments and between we see it the other way. A lot of government officials in Somalia do have a background in NGOs in the UN. We see that in many other contexts as well, Haiti, for example, Ethiopia. So I think as we get that better understanding, we need to be learning in both directions to move that forward. And then to come to Ricardo's question on when do we learn, I mean, I think a couple of things here from my side. One is kind of when is, and as George said, never waste a good crisis, right? So this is our opportunity to kind of use things like the evidence that we have here in the IAHEs to really push change, and there's many of us doing that. But I also think there's a challenge we have here on narratives. Too often you'll hear this, either the humanitarian system has a one-size-fits-all response, or it never changes. It's like, I've been doing this since 2021, and it has changed massively in the last 25 years. So I think it's also recognizing where we have made progress. And I think this is one of the things that from my seat on the IAHE steering group, I've been quite keen to say, actually, let's talk about what has gone well and what has changed and improved, because otherwise it's just depressing. It's really hard to mobilize frontline leaders, staff on the ground to get excited about this and to believe that change is possible. So I do think we need to work on that that narrative. But, and I think coming to your point, Ricardo, about kind of institutions, institutions do try and protect themselves. So we've got to be aware of that. And as you say, not waste a good crisis to keep making each other uncomfortable, keep challenging and keep pushing that change. Thanks.
Yeah, I think one of the things that struck me in some of the conversations I've been in the last few days is the inability or unwillingness of institutions to change, even in response to very significant crises. Like Julia's saying, we might well end up with, doing less with less, but basically having the same structures and functions, is that I think isn't reflective of the desire and willingness of humanitarians to change. So one of the things I've noticed, there's a lot of kind of interagency initiatives bringing together, can everyone sign on to this? All the organizations put their name to things, but how much of a different reflection or proposition for the way forward would you get if you asked humanitarians as individuals rather than institutions? Because often you find humanitarians to be much more progressive, much more willing to change, and much more critical, even of their own institutions and the institutions they're surrounded with. And I think that rather than getting organizations to sign up to things on learning and change for the future, maybe we should be approaching individuals and we'd end up with a different conversation.
Well, and maybe to quickly come back on that, working with the ISC principles, one of the things is that even at very senior levels, right, where you get chief executives, where you get secretaries general who are saying, yes, I'm committed to this, how the hell do I get my organization to make that particularly culture change? And I remember many years ago, I was on the recruitment panel as a staff representative for Oxfam's chief executive. And I remember her, this is in the late 90s, early 2000s. And I remember her saying how challenging it was for her to change her own organization, even in that position of power. So I think one of the things is also recognizing the limitations of power, but also thinking how things like these reports, and particularly the IHEs on Yemen's, and I think this one, talking to the head of UNDSS, how useful that is for him trying to change his own organization, having this external independent perspective. And that's where one of our big challenges and discussions on the IHEs is whether we can still afford them. They're relatively expensive, they're extremely high quality, they're a bit of a kind of gold standard solution, and is that something we can still support? I would say there's a good argument for that, given that, and I'm not convincing everyone of this, but given that they are extremely useful for driving that kind of change, and particularly I really value the fact they talk to affected people as well, and they talk to a huge number of different humanitarians, not just those in the positions of power. So yeah, it's going to be a huge challenge to kind of protect that over the coming months.
Yeah, the other thing, sorry, I'm not really supposed to have opinions when I'm the moderator, but on learning, the other thing is also, and the IHEs are really important in this, is that we don't need to go into a process of working out what we need to do. Oftentimes we already know what the answer is, and we have the evidence base, and we have the case studies, and we have it. And the issue is not necessarily knowing what to do or how to do it. It's being able to navigate that political change in order to make it happen, which is different. It often gets presented in different ways. Also, I just wanted to point out on on Julia's point about saving institutions or not. Localization. Was I just noticed in the evaluation that the perceptions of the people affected was that there was higher levels of trust of internationals, which I thought was really interesting and also has to be taken into consideration when pushing a very localized model, particularly through pooled funding. We have two questions online. One is, I really like this one. How humanitarian actors could prioritize between life-saving interventions and resilience-building efforts in this context of reduced resource availability? The evaluation talks a lot about resilience building, both about its importance and links to anticipatory action, but also the loss and the cost to it of focusing on life-saving and where that balance sits. And the second question is, some reflections on potential financing models that could compensate for the decline in bilateral donor contributions. Maybe we just go with those very quickly. No, maybe we'll ask George to start. George, is that all right? Just a quick response, maybe.
Thank you. No, good questions and tough questions. And are things that we're trying to navigate in real time. The sad answer to the first question on life-saving versus resilience building is that life-saving has to be absolutely prioritized at the expense of resilience building. However, as the evaluation identifies, the life-saving work can be far more enabling of resilience building, or minimally not have negative impacts on the resilience building efforts. But in the harshest of prioritizations that we have to do, we have to focus on those most at risk of perishing as a result of the humanitarian context. So our focus has to be on the life-saving work, and we have to work better across the humanitarian development, peace building, a collaboration to ensure that, all financing streams are going to be challenged, but the whole system needs to reconfigure around this in order to understand how the humanitarians can do their life-saving work, how it is that development and resilience actors can look at other means of financing the broader investments into resilience building that are necessary in a changing donor landscape. And such. And that sort of leads into the second question around potential financing models. And this is being discussed. There's a lot of discussions around non-traditional donors, of course, both on the humanitarian side and on the development side. The financing for development discussion needs to shift dramatically away from an ODA-driven model to other models of how can the public sector really invest better in service delivery for its population. I know this is really tough in a context like Somalia, where services have been externalized to external actors for such a long time, and where government's own revenue has been inadequate to, although if you look at their long-term, medium to longer-term planning, they do have, there's been a lot of work done around what would be necessary for national systems to start picking up on, what the humanitarians simply can't be doing anymore. And it's a complicated medium-term discussion, and unfortunately, the urgency around that discussion has been ratcheted up dramatically in the course of recent weeks and months, in ways that are going to prove very challenging for a context like Somalia, that's been so heavily aid-dependent for effectively 30 years now, to really try to turn that corner in ways that the government and national and other authorities can take better responsibility for the welfare of its citizens. Over.
Great, thank you very much. Gareth?
Yeah, so just really to second George's point on the resilience versus life-saving, a couple of points to add. Clearly, we've got to save lives, but I think we need to be clear on the consequences of this, and we've got to communicate that very clearly and build the evidence base on that. And as George says, we need to be smart about maintaining that space for sophisticated programs. One of the big worries is that we go back towards the more kind of 1980s truck and chuck kind of style of program that we know is inefficient, but it's very visible. One of the realities realities is that in-kind food aid, which we know isn't terribly efficient, but will be maintained through this cut because it has big farmer and shipper support in the US. We know that's not the most efficient aid, but we also need to work within those parameters. I mean, I think in terms of the potential financing models, it's interesting. A lot of people say, well, okay, now we need to really invest in kind of alternative financing in, some of these flexible things. I'm not convinced by that. I think we have, particularly some of the SCHR members at ICRC, particularly invested very heavily in some of those alternate, catastrophe bonds, things like that. It didn't make a strategic difference. It was useful on the margins, definitely, and some of those insurance has been useful for some of the members, but it's marginal. It's not strategic. And I think this is why we need to be clear on the consequences of not being able to do that prevention, not being able to do that, and looking at capturing the counterfactuals now that we're running a very brutal experiment here, which says, hey, what if you did take out the international humanitarian system? Well, that's going to happen in a lot of contexts, and we need to be careful to make sure we're capturing the impact of that, and then building a movement to say, actually, these things are preventable. Yes, it's always messy around the edges, but actually what we've done over the last 20, 30 years has saved huge numbers of lives, has made the world more stable, has made the world more progressive. And I think building that movement in the long term is, and yes, it's definitely a long game, but I think that's probably where to put our energies rather than hoping that private sector or someone else will suddenly come up with new funding or alternative donors as well. I know that's something you hear a lot. Again, very useful in the margins. We've seen, particularly in some Middle East and North African contexts, where those new donors have been essential. But for example, the Saudis put twice as much money into a golf tournament as they put into humanitarian aid last year. I mean, I think you need to be realistic about that, and holding out hope that, for example, Turkey might step up or China, I think is probably not the most cost-effective place to put our efforts in the coming months and years.
Thank you very much. Julia, I'm going to give you the last word.
Well, that's nice. Then now I feel bad because I wanted to put in a word of caution on those life-saving bit, because to me it's interesting. I mean, the humanitarian sector or humanitarian assistance, the idea was you help people survive when they are hit by an unexpected shock. And I think we do have quite a lot of situations where we have gone quite far away from that, and it's still life-saving, but not in response to shocks. So, when we do seasonal responses, because, when the seasons evolve as we expect them, like we do in Sudan or South Sudan, for example, it's life-saving, but it also implies that we have maneuvered ourselves into a way where we permanently need to save lives, where we just don't have a system that, even if it doesn't have a major shock, works for people. And I have a feeling that we need to get out of those kinds of life-saving situations, and it is through longer term finding a different equilibrium that we do that. Whether humanitarians and their resilience activities are best placed to do that, I don't know, maybe not, but that we can't be stuck in permanent emergency without unusual shocks is also, to my mind, clear.
Thank you very much. We're at time. It's been an extremely rich and interesting discussion. And yeah, just a reminder, as we go into difficult times, we are rich in learning, evidence, and knowledge. For everything that we are likely to lose in this next year or two, we will not be losing the evidence and knowledge and learning that the humanitarian has already banked over the last 25 or 30 years. And it's an obligation on all of us to use it in informing the decisions and actions that we make as we move forward. Thank you all very much. Thank you, George, Gareth, and Julia, and thank you online as well. Thank you very much. My favorite people.